The following is a presentation of Be Well, a multiple media health information project presented by WVIZ PBS, IdeaStream. Funding comes from the Dr. Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, the Woodruff Foundation, and the Community Foundation of Lorain County. Additional support comes from the Mount Sinai Healthcare Foundation, the St. Luke's Foundation, the United Black Fund of Greater Cleveland Incorporated, the Faro Foundation, and RPM International Incorporated.
Childhood obesity is a complex problem that requires complex solutions.
This is the first generation of kids that are expected to live shorter lives than their parents currently do.
We can ask ourselves the question, are we actually killing our children with food?
Kids don't want to have this because it's not fun.
A can of pop costs less than a bottle of water. You know, that's a problem.
Nowadays, these kids are stuck to the TV, cell phones, and playing games.
It's frightening to see how insidious obesity has become.
From our perspective, the prevention of development of childhood obesity begins before and during pregnancy, in the womb.
One of the keys to it is really getting back to the soils and really growing things the way they're intended to be grown.
I'm very determined because I have a lot of things that I want to do with life.
Personal stories from local families. Insight from doctors and scientists who are fighting the fat. Coming up next, Be Well, Young and Obese.
Most people don't question that childhood obesity is a big problem. The real question is, what are we going to do about it? Hello, I'm Rick Jackson. For the next hour, we're going to take you all across our region to a farm, laboratory, school, hospitals, and homes to better understand the complexity of childhood obesity and to see how some kids and adults are fighting fat. There is no magic pill or silver bullet that will solve this problem. Dr. David Katz from Yale University's Prevention Research Center is a nationally recognized expert on childhood obesity. Here's what he told us about solving this problem.
Every strategy, every program, every practice, every policy that will empower people to eat well every day, to be physically active every day, to manage their time better every day, for adults to do this, for kids to do this, is part of the solution. But no one thing we do will be the whole solution.
Before we get into solutions, let's first understand how we got here. The two big culprits are diet and exercise. Simply put, more and more kids eat too much of all the wrong things and exercise too little. To give you an idea just how bad the problem is across Ohio, we're going to show you a map created by the Center for Child Health and Policy at UH Rainbow Babies and Children's Hospital.
It's a county-by-county look at the weight of third graders in Ohio. These are kids around 8 and 9 years old. Researchers consider these to be estimates based on how the data was collected. In the counties colored light blue, only 5 to 10% of third graders are obese. In our region, that includes Medina and Geauga counties. Now comes a sprinkling of royal blue. Lake and Portage are among these counties in which 10 to 15% of third graders are obese. Next, dark blue, representing places where 15 to 20% of children are obese. Cuyahoga, Ashtabula, and Wayne counties come up here. Yellow makes up the majority of the state, where 20 to 25% of third graders are obese. These include Erie, Lorain, Ashland, and Summit. So now we go to orange. In these counties, 25 to 30% of third grade children are obese. Sandusky and Huron are the unlucky winners here. Finally, we get to red, signaling places where over 30% of third grade students are obese. These trouble spots are mostly in southern Ohio.
All in all, about 500,000 children in Ohio are overweight or obese, and in the coming hour, you're going to meet some of them. But chances are you're going to think, well, they don't look obese. The sad reality is, these days, so many people are so fat, we've become desensitized. We've lost track of what a healthy body looks like. Doctors use a mathematical formula called BMI, or Body Mass Index, along with age and gender to rank children into weight categories. BMI rankings give doctors an objective way to alert parents of weight problems, regardless of appearance. In our first story, we meet Victoria, a typical tween who helps us understand some of the problems kids face when it comes to weight management.
My name is Victoria Samarjia. I'm 12.
I'm going to be a teenager soon. I like all of the boy bands now these days and the guy singers. I do swimming, lacrosse. I'm going to do volleyball and maybe do soccer. Baca is my grandma, and she loves to cook. Every day she cooks. She cooks us meals. She cooks us snacks after we come home from school.
I make a goulash, mashed potato, corn mesh on the soup.
And what about the strudel?
Strudel too, yeah, cheese strudel.
I love her food a lot. It really is hard to resist because just like the taste of it is just so good. It's just when you smell it, it's mouth-watering.
It's a lot of rich food, a lot of sauces, a lot of gravies, lots of carbohydrates. Tori's the type of child that enjoys food. At age 2, she was starting to gain some weight. From then, it's just progressively gotten worse.
Sometimes I'll eat out of boredom because like I'm bored, so I don't have anything else to do.
Society is like against the kids, because both parents do have to work nowadays. It makes it much harder. There are some days that I don't get home until after 8:30, 9 o'clock at night. Same with my husband.
It's easier on Friday night, order a pizza, sit down, eat, watch TV, and go to bed.
Hey, Tori, how are you?
Hey, good, how are you?
Good. What do you got for me?
I've been going to Fit Youth on Tuesdays for 12 weeks.
Fit Youth is a program that is focused on children and teens who are identified as being obese at a certain BMI level. So even though the child is identified based on weight, the key is really parents and the family. We have a multidisciplinary approach to this. It is not just focused on weight. It is focused on getting our bodies moving, how we think and feel about things, how we eat, where we eat, how much we eat. So it's really important to have the behavioral specialist, the exercise physiologist, the dietitian, and also the pediatrician involved. It really is a healthy lifestyle program.
They have a psychologist who was there, so we do like a half hour with her, and then from there we do go to the dietitian.
One of the things that we use in Fit Youth is this new idea called My Plate, which is a visual that helps kids and families really consider portion size in a more user-friendly way.
You said you got avocados this week.
We do learn from each other. We bring different ideas to the table where all of us can share those.
I've learned like some psychology things like bullying, hunger scale. Before I go and get a snack, I look at the hunger scale and see if I really am hungry or just full or if I'm just bored.
The hunger scale is a tool that helps not only with the physical aspects but the emotional aspects. Being more mindful about why am I thinking that I'm hungry right now?
I have learned as much as Victoria, definitely. Having the ready-made foods, processed foods, it's easier as being a working family. But by changing habits as a working family, by maybe preparing foods on the weekend, on Sundays is what I have changed. Take away the cookies, take away the sugars, take away the junk. Kids do not need junk, and I think as a society, we have learned that by giving them macaroni and cheese, processed food, that it's okay. It's not okay.
Hey, Baca, can I have a carrot?
By going through the program, it has changed the way Baca has been cooking for them. She has gone to lots of vegetables, doing lots of salads, vegetable soups, offering fruits.
Pick your feet up, pick your feet up.
Victoria has lost some weight, but more importantly, she's getting healthier.
Before, I would run out of breath after like 5 or 10 minutes of running.
It is really exciting to see these kids feeling like a whole person and feeling strong in their physical self.
Victoria is determined to keep her weight under control. She doesn't want to face medical problems later in life. And besides, there is a history of heart disease and diabetes in her family. Dr. Sharon Maripol is with the UH Rainbow Babies and Children's Hospital, and she joins us now to talk about really the consequences of childhood obesity. Welcome. Good to see you today.
Thank you. It's good to be here.
Amazing statistic. 1 in 5 American teens already pre-hypertensive or has high blood pressure. Explain what that means and what happens in terms of arteries, kidneys, the other consequences.
Well, high blood pressure is something that you may not realize when you have it because it doesn't cause any immediate symptoms, but it's constantly working on your body that causes all kinds of harm, such as if you have high blood pressure, you're more likely to deposit cholesterol, fatty plaques in your arteries, have heart attacks, have trouble with your circulation in your limbs, have strokes, and have other complications, kidney failure. So it's related to a lot of diseases that it's causing harm to your body all the time that your blood pressure is high, even though you can't feel it.
These are long-term consequences we're going to see years and years down the line,
right.
Not necessarily when a child is this age.
Right. This is the first generation of children that may have a shorter life expectancy than their parents.
That is frightening. The threat of diabetes or pre-diabetes among teens, we know, up from less than 10% in the last decade to nearly 25%, just an 8-year period that started in the late 1990s. That has to be terribly frightening to doctors.
It is frightening to doctors, and what's really important to know is that it's preventable. It's much easier to prevent the development of overweight or obesity than it is to treat the consequences later on in life. We can treat them, but we can't treat them very well.
You were saying that there's a likelihood of obesity among children toward diabetes. Give me those numbers again. It was just stunning.
Yes, a child who's obese is 4.5 times more likely to develop diabetes sometime in his or her life than a child who's not overweight or obese.
4.5 times. When you sit down and you explain that to not necessarily the child but to the parent, do people realize this?
I think that they realize it maybe academically, but they don't necessarily think that their child is the overweight or obese one. And the consequences so far off in the child's life are sometimes don't feel as real to them as consequences that would happen today or tomorrow. And also preventing these consequences entails lifestyle changes, not just for the child, but the parents and the family as well. So it may seem overwhelming.
I can't imagine there's anything harder for you as a doctor than to sit down and say to a child, you are clinically obese. It's got to be an emotional low for them.
It's really hard. You know, in theory, we're supposed to sit down with families and be very clear. Your child is obese and is at risk for all of these terrible health effects down the line that we can hopefully prevent. But it's hard for us to say that to families because parents find that upsetting. They don't like to talk about things in front of their child that's scary. But unfortunately, one of the issues is we as doctors in the health profession need to communicate these scary facts clearly to families. So the families, that's only fair, so the families can act on those facts and prevent the consequences for their children.
And lastly, Dr. Maripol, I guess there's less of a stigma than there used to be when you and I were kids. You didn't see as many large kids. Now, are they more used to it and so they think it's okay that I am too?
Unfortunately, I think that may be true. Traditionally, being overweight or obese, in addition to the short and long-term health effects it had for children, it also has psychological effects. They get bullied, they get teased, they have a hard time fitting into fashionable clothing. It's harder for them to participate in athletics. And I know that that still is true. Certainly the short-term and long-term health complications are still just as true as they used to be. But as the population gets more and more overweight or obese, I think it does tend to normalize it for both their kids and their parents. So they may look around and they may not realize how much of a risk and a problem it really is.
Thank you so much, Dr. Sharon Maripol, UH Rainbow Babies and Children's Hospital.
Thank you.
There's no question that both the emotional and physical consequences of childhood obesity are devastating. 70% of obese youth already have at least one risk factor for cardiovascular disease. To be blunt, we have a generation of young bodies getting old people diseases. In some cases, children are actually losing the function of their organs. That's precisely what's happening to Kimberly.
All right, Kimberly, so I'm just going to explain to you about this fatty liver that you have, okay? So this is a normal liver, it's smooth. When you have fatty liver, you start having fat inside the liver and it looks kind of like yellowish like this.
My name is Kimberly, I'm 12 years old. Kids don't want to have this because it's not fun. A lot of pain, a lot of surgeries, a lot of getting poked. You don't get to do things that other kids get to do.
So in Kimberly's case, she progressed to having liver cirrhosis, which means that she has significant scarring of the liver and the liver is really stiff and hard. Okay, so I'm just gonna feel for your liver. So most likely she will need a liver transplantation during her lifetime because of obesity. The end result is the same as alcoholic cirrhosis. So this is a shock. I mean, when you tell parents that your child's liver looks like an alcoholic, this should be a wake-up call for any parent. So when we look under the microscope, you can see these big droplets of fat and they replace the entire liver cell, and that makes these cells sick and they cannot function properly.
All right, so we're going to talk about what a healthy portion is, specifically for meat and starch. The portion of meat should be about 4 ounces, which is about the palm of your hand.
The biggest thing we've been working on with her is her diet, getting her to lose the weight, watching her cholesterol, watching her sugar.
Okay, honey, you want to come over here?
It makes me upset that children are having these complications, but also makes me want to get the word out and educate people about this problem and make sure that it is diagnosed early on. Okay, I'm just going to listen. People will be shocked to learn that fatty liver disease is affecting 1 in 10 children in the United States. It is the most common form of chronic liver disease in the United States in children. Kimberly's case is rare that she progressed to cirrhosis during childhood, but this has been reported in different studies, and we expect that this will happen more and more often now that we have more children affected with fatty liver disease.
I wanted to do this to make people more aware of it, because I'm going through it. You know, some of these parents have, you know, little kids that are just starting to gain the weight and they're not worried about it. Trust me, be worried about it.
The liver is just one organ in a child's body damaged by obesity. Also at risk, the heart, kidneys, pancreas, and vascular systems, to name just a few. Avoiding complications requires a steadfast focus on 2 basics: diet and exercise, but not just at home. Remember that from kindergarten to 12th grade, the average kid spends nearly 6.5 years of their life in school. Unfortunately, healthy, nutritious meals are not the norm at most schools. Now, Terry Allen is the commissioner of the Cuyahoga County Board of Health. Terry, good to see you again.
Glad to be here, Rick.
One of the things that kids do is eat in school. Some kids have 1 meal, some 2 or 3. Almost half the kids in Ohio participate in their school's lunch program. What are kids eating right now at school?
Well, they could be doing a lot better than we'd like. We know that certainly from national coverage on this issue and what we see in schools here in Cuyahoga County and around Ohio is tater tots, pizza, burgers, things that aren't healthy, choices that you prefer they wouldn't make in the schools. Those are occurring. We know that there are competitive foods also that are brought into the schools. It could be fast food that's put in the front of the line so that kids are more likely to choose that. It could be other competitive foods where people are doing fundraisers and bringing in high calorie dense, high sugary foods, brownies, lots of candies, the sugar, salt, fat, human instinctual thing that we're all drawn to. Those are problems that we need to combat, and it affects our kids' ability to learn.
You've just depressed everybody. But
sorry about that.
What is it that schools do that brings us in? Why do they do this?
Well, I think I may have depressed people to try to really state the fact that I think we need to create an imperative to do something about it in this country. And so part of it is that in terms of guidelines from schools, they're making choices, I think, first of all, on what they think it'll cost them to feed kids. And there's this sense that eating healthy will cost more, and so they're concerned about the bottom line. It also could be issues around facilities to prepare the food, whether that's available for them to actually work to make fresh food available to kids.
I think most people assume the school is making its own food, and they aren't.
Right, I think that's not always the case, and in many cases it's not true at all.
Who makes the determination when it comes to the overall picture? Does the federal government weigh in? Does the state government weigh in? Or is it each school system weighing in what it wants to serve?
Well, in terms of the school meals program, USDA has some guidelines that they provide that generally affect all schools. There are some new guidelines from Senate Bill 210 that was passed in 2010 here in Ohio that provide some guidelines, particularly around vending, for instance. And so beyond that, the school systems have their own food service companies that also work with them to determine what the school menu will be.
Terry, stay there for a minute. I have a couple of more questions, but first, let's look at another story. Getting kids to eat healthier food at school is the idea behind farm-to-school programs. They get locally grown fruits and vegetables into school cafeterias. The first such program in Cuyahoga County is called Students Eating Locally, or SEL. It's being held as a national model to fight childhood obesity and involves a unique partnership between the Cuyahoga County Board of Health, the South Euclid-Lyndhurst School, hence the SEL, and a man known as Farmer Floyd.
My name is Floyd Davis. I'm the owner of Red Basket Farm, and I work with the South Euclid-Lyndhurst School District, and the kids there like to call me Farmer Floyd. Depending on the season, it really dictates what it is that we grow for the school. Obviously, during the winter, we have to do it in the greenhouses. We can do spinach. We do several varieties of lettuces. We do kale, we do collards, radishes, turnips, broccoli. In the summer we do sweet corn and tomatoes and cucumbers and peppers.
So I want to taste this. It's so flavorful.
Yeah, and that has a lot to do with the way that we grow and with the soils. I mean, we mineralize the soils, we use a lot of compost, follow a lot of organic practices. The key to everything is really the soil. It's the foundation of everything, doing things and growing things the way they're intended to be. Right now we're taking anywhere from 30 to 50 pounds a week of spinach into the schools. About 3.5 years ago, I got a survey from the Cuyahoga County Board of Health, and they were looking for growers who wanted to participate in a farm-to-school program. They had identified a school district, and so they were looking for growers that would be interested in supplying the school district. Now we need you want to get a liner?
So this is Floyd's survey that he responded to, and one of the things that caught our eye about the survey was not only the variety that he had to offer and the interest he had in working with local school districts, but also the fact that he was driving past South Euclid-Lyndhurst School on his way downtown to the farmer's market.
So what do we have? We got spinach, we've got leaf lettuce, we got head lettuce.
My name is Calvin Needham. I'm the food service director here at South Euclid-Lyndhurst School District. We were getting produce from California, which is a little over 2,000 miles away. It could take about a week or so for it to get here. The good thing about this spinach is that the stems are so tender, and with the stems, this is the nutritional highway.
We have found that getting fresh produce from the farmer is actually less prep time than when we were purchasing it from a distributor. I think this is great. It's probably one of the most exciting things I've seen in school food service in all the years I've worked. I have been here 26 years. Stems just go right on in with everything else. We just dice them up. At first, the kids were a little bit hesitant, but now that the kids have gotten used to it, you can put all the stems in because they're so tender because they were just picked from the farm.
What would you like? This program actually allows us to eliminate some of the processed, prepackaged items that kids were normally used to seeing on their school meal line. We now have 6 salad bars across the district. We know that in our county, only a quarter of our middle school and high school kids are eating the recommended servings of fruits and vegetables a day, so we are providing access to fresh fruits and vegetables that they may not have outside the school day.
How does this taste compared to like different, like the canned spinach or something?
Compared to that one, this one actually tastes better.
Why?
Because it's not like canned up and then water and stuff like stuck all together. Then it like makes it taste weird, not like a good fresh salad.
This is like right from the ground.
Yeah.
Eat it.
A bite. I feel like I'm eating a leaf. I feel like I'm eating a leaf.
The program also looks at making connections to the classroom, whether it's nutrition education, agriculture education, or hands-on learning through the use of gardens. We now have 3 hands-on learning gardens.
They're able to get their hands dirty and learn different things about agriculture, how to grow different foods, how to compost and be sustainable.
What do you think about planting your own vegetables?
I'd say it sounds like a good idea.
Why?
Well, some people think that it's better and it's more likely that people eat healthy foods if they grow the foods themselves.
And do you think you're getting to like vegetables more because of this program?
Yeah, I used to hate them.
Now you like them more?
Yep.
Why?
Because it's fun to learn where they come from and then eat them than to just buy them in a store.
So are you learning some things that you can share with your family members?
Yeah, because my grandma, she's trying to plant a garden in her backyard. So because of this experience, I can help her with that.
The bottom line is we need to begin to create conditions for kids, adults, residents, everybody to make healthy decisions. We can't just expect that because we tell people you should eat 5 servings of fruits and vegetables a day, that they're going to be able to go out and do that. And it's going to take non-traditional partnerships and thinking outside of the box to be able to create those conditions for people to make healthy choices.
The Students Eating Locally project is really a win-win. Children are eating healthier. The school district's revenue from school lunches is up, and the local economy is getting a boost from Farmer Floyd's expanding business. And the future of this program is secure. In 2011, the South Euclid-Lyndhurst School District became the first in Ohio to pass a school wellness policy containing farm-to-school language, which guarantees that program will continue. Terry Allen, Commissioner of the Cuyahoga County Board of Health, joins us again. You guys had a lot to do with putting that together. You have to be pleased with the success, but what was your reaction in seeing it come to fruition?
Right. We're really proud here. It's the first program of its kind here in Cuyahoga County, and we think it's going to be a model for the whole area. I think we were involved with our staff, working with the schools to make the case that you can do this cost effectively if you allow the time and put the effort into it, and the kids will come. They'll come to the salad bar, they'll eat the vegetables, and that's exactly what happened. We know that kids that are eating well are going to do well in school, and so that model now can be carried forward by the lunch lady, by the school district leaders, with other schools in Cuyahoga County.
And lunch ladies do talk amongst themselves, right?
They most certainly do, and lunch ladies listen to lunch ladies. And we think that that's the model we need to take forward, and we know there are other districts that are interested in doing what South Euclid has
Yeah, I was going to
accomplished.
ask, if other
Right.
superintendents come in and said, hey, it's working at SEL, let's try it too?
Right, we did a survey actually countywide, and we found that 20 school districts and 18 private schools are interested in carrying the model forward. There's less waste. We know that the kids are eating the salad bars more than they used to and the other vegetables. So all these things are moving the needle in the right direction.
Even the STEMs. Okay.
Absolutely.
The food service program kind of has to buy in. They have to agree to let their school, as it were, participate.
Right, and I think there may be some initial resistance to the way things have been done over the last 10, 15, 20 years. But once they see that kids are consuming the food and they're prepping healthy food, I think it's a win-win across the board.
How important is parental input? They see a story like this on television, they go, I want that in my school.
That's absolutely huge. We know that certain parent groups and parent-teacher involvement is critical. Parents have to demand that these things are available for their kids. We know that kids that are eating well are going to perform better, and we know that it's time to begin to change this trajectory on obesity in this country, and this is one way to do it.
You just mentioned performance there. We see at the same time not just food, but schools are cutting away some of the things that helped kids to stay healthy.
Right. We think you've got issues around physical activity in the school system. We know that in 1969, 42% of kids biked and walked to school. In 2001, that was down to 16%. Cutting physical activity out of the school system is a big issue because a sound body is a sound mind, and you're eating healthy, you're physically active, you're going to perform better. We need to change that trend.
You mentioned competitive foods earlier. We haven't touched on vending machines. How do they get so proficient or so proliferous in the schools?
Right. I think the big issue is that vending machines are provided and often stocked by soft drink companies that buy scoreboards and buy uniforms. And that's happened very quietly over the last 20 to 30 years when school budgets have been tight. And that trajectory needs to change because there's a lot of empty calories in sugar-sweetened beverages, and that's a big link back to diabetes, a big link back to obesity, and that's one of the biggest problems we have to deal with in the
These
schools.
companies are being good neighbors, but at the same time they're sliding their product in there.
Right.
How much does celebrity help? The Jamie Olivers, the Michelle Obamas, the Rachel Rays of the world. Does that play in? People see that?
I think so. They have the national image to take it forward, and I think what that ties back into is the national imperative that we start to change the way we do business. 75 cents on every dollar spent on the chronic diseases that result from choices that we make as kids.
75 cents.
75 cents on every dollar. That's $2 trillion spent on health care. We have to change it or we're going to bankrupt the country.
Terry Allen, Commissioner of Cuyahoga County Department of Health. Thanks so much for your help.
Glad to be here, Rick.
This program about childhood obesity is just one part of IdeaStream's ongoing multiple media health information series called Be Well. This is such an important problem that we've made a commitment to spend the entire year covering the topic on radio, television, and the web. Go to health.ideastream.org for links to articles, studies, stories, and local resources, all designed to help you better understand obesity and how you and your family can live healthier lives. Be sure to watch the web exclusive about a local doctor who's working on a breath test for kids that could help determine if they are at risk of developing fatty liver disease. If perfected, it will make diagnosis and prevention a whole lot easier. And be sure to listen to radio reports filed by my colleague Ann Glosser. One examines the challenges and benefits of fitting exercise into the school day. All this and much more when you go to health.ideastream.org. Now, at the beginning of this program, we heard from a national expert on childhood obesity who said there's no magic pill to solve this problem. It's just too complex, requires intervention at lots of different levels in our schools, in our neighborhoods, and in our homes. New interventions are being developed and tested in a local research study by Case Western Reserve University and Rainbow Babies and Children's Hospital at university hospitals. The study is called IMPACT, and it's part of a massive nationwide effort designed to find the best ways to treat and prevent childhood obesity. 11-year-old Jake and his family are part of the study. Essentially, they've filled their lives with little experiments, things they think will help fight the fat.
Dig it out, dig it out, dig it out. Come on. All right, breathe, 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 breathe. You want to go one more time?
My name is Jake Streeter. I'm 11 years old, and my dad is like my athletic trainer because when I get tired while running around, he gives me that motivation.
When you're going to push out, you make sure you breathe out, okay? Breathing is important.
For Jake and his dad, these workouts are part of a mini experiment they're doing for the IMPACT study.
So tell me about this experiment.
My experiment is sleep and exercise.
IMPACT is testing different ways to help children and families battle obesity. Jake's in a group testing an approach that calls for kids and their parents to come up with ways to make small changes in their daily habits.
One of the things that we do, for instance, to how to get a family started on this, is we have them flow chart their daily routines. Okay, what do you do first, second? The kids do it and the parents do it. And then it kind of pops out at them some of the things they do that aren't very healthy or opportunities that they could fit something in that would be healthier.
All right, so can we start with you, Ms. Jasmine? You want to tell us what experiment you've been working on?
So they go through very small, we call them self-designed experiments to change something in their environment that would be more healthy for them. We let them do experiments around diet, around exercise, which includes reducing sedentary activities, screen time on TVs or devices that the kids use today. Also, sleep is a very important behavior that we have them work on, and then stress management.
Well, I learned new words, sedentary, like has something to do with like moving and, well, not moving, like just sitting there doing nothing. So what it trying to not be sedentary, like have to cut my TV time out. Well, today we went for a jog this morning.
Okay, write it down.
Jake chose to focus on exercise and sleep.
The sleep part was a bit of a shock to me because I was thinking that he was getting regular sleep.
So we know that children who get less than 5.5 hours of sleep a night are more likely to not manage weight well and actually be overweight or obese.
One issue with sleep has to do with the blue light emitted from television screens. It acts as a stimulant, disrupting good sleep. Jake's experiment calls for him to make sure the TV is off before he goes to bed. Family dog Damon is part of another one of Jake's experiments.
some of the habits we have are like when we wake up in the morning, like walk the dog, come in and just go straight to watching TV. But really we're trying to change that to like walking the dog for long distances. It's fun because the dog's enjoying it too. If the dog's enjoying it, you can enjoy it too because your dog's having fun.
So was this a little tip that you thought of?
Yeah, I thought of this, like walk the dog farther distances so you can get exercise too.
The fact Jake thought of this himself may be the magic behind this new approach to fighting obesity.
It comes from them. It's their energy. It comes from their family. They own it.
We need like 2 more handfuls.
While Jake and his family are having some success with their experiments, they admit change is hard, so is battling weight.
It's a struggle for Jake, it's a struggle for myself, but each day, we take it one day at a time and try and do a new thing.
The most difficult part as a parent is because you want to protect them and you kind of like, well, I don't want kids to pick on them because of his weight or things like that, but then I've always taught my children to be independent and to like yourself because you like you, not based it on whether or not other people like you. So you don't kind of want to pressure them to change it because you want them to be accepted. You want to do it because it's something that they feel that they want to do.
Besides focusing on things at home, part of the impact study has a school component. Some research participants, including Jake, are taking part in the YMCA's We Run the City program. It trains teams of Cleveland students to run all or part of the Cleveland Marathon.
I'm proud of him for having the courage to push himself to do it. Being one of the bigger kids in his school, it takes courage, just to keep going no matter what.
Step up. Step down on the beat.
Jake and his family are focusing on mini experiments, but Impact is a massive study that includes hundreds of local kids who are trying different approaches to weight loss. After 3 years, researchers will figure out which approach helps the most children lose the most weight. In the meantime, it seems at least some of Jake's experiments are paying off. At the 2013 Cleveland Marathon, Jake ran a 1.2-mile stretch of the race.
Some of my friends were encouraging me and stuff, so it was actually kind of fun.
I'm so glad we made it to the finish line. I'm so proud of him. He's encouraged the whole family to get up and run every day.
With him, anything he puts his mind to, he can do. So I always bring him back to that. Anything you say you're going to do, you can do. So if you want to lose the weight, you can do it.
I'm very determined because I have a lot of things that I want to do with life.
Something else researchers in the Impact study are looking at are things in the neighborhood that act as sabotagers to healthy behaviors. One example is children who live in so-called food deserts, where there are lots of fast food restaurants and corner stores filled with junk food, but with limited access to fresh fruits and vegetables. Joining us more to talk now about the various environmental factors influencing the childhood obesity situation is Dr. Ron Adams, the Senior Physician for Quality at Kaiser Permanente. Thank you so much for being with us today.
Thank you.
Good to see you here. We talk about kids essentially being prisoners here. They don't have a choice. They don't get to choose where they're going to live. They don't choose where they're going to go to school. Environment, though, is so important for children.
Exactly. Children during the course of the day go from home to school to their communities, and each one of those locuses or influence types of choices that they can make in terms of healthy eating and also promoting physical activity.
It's interesting in terms of fighting obesity, when we talk about these food deserts, the opportunity to become obese is right there. Do they have the opportunities to do something different?
Well, you have to really think about the choices that you're going to make. And when you're in an environment where there aren't many choices, there are actually some choices that you may have to search a little harder to make a better choice.
Environment doesn't just refer to home, though. We talk about the neighborhood, but we also talk about church, we talk about school, we talk about any clubs you may join into. It all ties in?
Exactly. And dealing with obesity really is a community effort. It's really something that requires a public health initiative. And so it involves not only the home, the school, your churches, all have to have a strategy to act on to make it happen for a child and a family to be successful.
Well, you mentioned the family. How can parents help to change that environment?
Well, one simple way is for a family to do what I call a food inventory. Open the pantry, find out what's there, pull it out, and look at what types of foods that you're eating. And really pay a lot of attention to focusing on labels. because you may not realize that you're consuming foods that are calorie dense and nutrient poor. And so doing that food inventory gives a family an opportunity to see what they're really eating. Secondly is families can begin to focus on movement, getting away from televisions and computers, but focusing on activities together where a child and a family can begin to spend more time on activity. And particularly children need about 60 minutes of activity per day.
And like Jake did, walk the dog if you have to.
Find what works best for you. I mean, what we're finding is that people need to come up with their own solutions. And if you allow them to make those solutions, come up with those solutions, they will make the ones that work best for them.
You talked about the idea of pulling the food out, looking at the labels. We have to be examples, though. If you and I tell our 5-year-olds and our 10-year-olds, you have to eat well, and then we're sitting there with a bag of chips.
Well, you have to model. And if you don't model well, children will model what you do. And if you're doing the wrong things, you're not going to be successful. So obesity for children really is a family issue. You just cannot just focus on the child. You must begin to focus on the family in order to be successful.
Is it difficult for families to change all these environmental factors?
Well, it is hard. But you know, convenience is part of modernity. And so we have to kind of figure out things that we can do that while we may think they're convenient, they're actually harmful to us. And so changing lifestyle is really important. Not dieting. Dieting is the wrong word. It's really about changing a lifestyle, because the things that you need to incorporate to be successful is not something that you do for 1 week, 2 weeks, or 90 days. It's something that you're going to be doing for the rest of your life.
When you're talking to your patients, is it hard to stress the idea that environment matters?
Well, what happens is a lot of this activity is very passive. People aren't aware that these things are going on around them. They're not aware that they're not participating in physical activity. They're not aware about healthy eating. And so it seems almost next to impossible, but by giving them an opportunity to see and to also allow them to solve these problems themselves, they can come up with reasonable solutions.
Dr. Ron Adams is with Kaiser Permanente. Thank you so much for your time today.
Thank you.
We often hear overweight adults say that obesity is something that runs in the family. And it's true that some are genetically programmed to gain weight. Some of those genes are a product of evolution, dating back to our hunter-gatherer days, when food was scarce and it was necessary for humans to store fat. But modern-day environmental and behavioral factors like too much fast food and too little exercise also change the DNA in our cells. And some of these changes may actually start in the womb. As we see in our next story, overweight and obese women who get pregnant may be unintentionally and unknowingly programming their fetus to become a fat child.
My name is Brianna Dotson and I am 10 years old, and me and my mom are a team at trying to lose weight. Like, we'll have a competition. Like, I told my mother she can't drink pop and she said I can't eat sugar or none of that.
So we started sort of doing things as a joint effort with each other to kind of help each other along the way.
Go ahead, step up.
Our pediatrician at our last visit brought up, and visits before, that we really need to get on top of like really watching her diet, because she's over in the 95th percentile. She should be somewhere between 25 and 50%. Brianna's 4'4" and she weighs 106 pounds. Which one am I? Oh.
You're Michael.
She's not embarrassed, nor am I embarrassed about it. We sit and joke with each other sometimes when we work out on the Wii sometimes. You know, we don't take it personal, because we recognize it as an issue and that it needs to be fixed and addressed.
And so you're a mother-daughter team going at it early.
Correct.
So you're here to do a follow-up on the HAPO study.
Talitha and Brianna are also a team for medical research. It began 10 years ago when Brianna was developing inside her mother's womb. Talitha agreed to be in a research study. Doctors checked her weight and other things like whether she had diabetes. Now, a decade later, researchers want to know how such issues may impact children like Brianna now, especially when it comes to weight.
It's going to be helpful because it can tell us what risk factors are going to be most important for the development of something like childhood obesity that occurred during pregnancy. Was it the mother's weight before she got pregnant? Was it her weight gain during pregnancy? Was it her diabetic status during pregnancy?
Dr. Patrick Catalano is researching ways to prevent childhood obesity at the earliest possible stage, in the womb.
If you look at the environment that a fetus grows in, it's different if a woman is overweight or normal weight.
Talitha was heavier when she got pregnant with Brianna. And one thing Dr. Catalano is looking at is whether that's somehow related to what's going on today with Brianna.
So I'm going to have you go ahead and turn around like this so that I can see your shoulder blade and see the back of your arm.
Time will tell. The study will enroll a total of 300 mothers and children and last 5 more years. Meanwhile, Dr. Catalano and his team are working on another set of studies.
Actually, I have 3 samples from lean patients and 3 samples from obese patients to compare.
Okay.
They're trying to figure out what actually happens inside the bodies of lean versus obese pregnant women. At Metro Health, some women delivering babies agree to donate tissue. In one experiment, scientists grind up pieces of fat. In another, they slice off slivers of placenta.
Basically, we're doing the experiments outside of the body, in vitro, in the dish, but we're trying to replicate conditions that women who are obese might have during pregnancy.
What we think is that the environment that a woman who's overweight or obese has in her bloodstream, her nutrients in her bloodstream, her glucose, her sugar, her lipids, can affect the way that the fetus develops in the womb.
Catalano views the problem of childhood obesity as a continuum of what happens before, during, and after pregnancy. For years, doctors have warned women don't gain too much weight during pregnancy. But Catalano says the more important issue may be how much a woman weighs before she gets pregnant.
Well, we think that the relationship between pre-pregnancy weight is there early because the environment, the metabolic environment, the nutritional environment that's there in a woman who's overweight or obese is different from a woman who is normal weight. For example, that environment affects the way the placenta grows. The placenta is an important component of how the babies get the nutrients and how they grow. How you program that placenta in the first few weeks of pregnancy may have an important outcome 6, 8, 9 months later. You don't see it till later, but it exists early.
For years, pregnant women have been advised not to smoke or drink. Now it's time to add fat to the list.
Over the last few years, we realized that smoking during pregnancy is not healthy. We know that drinking during pregnancy is not healthy. The next thing we want to realize is that getting to a good weight and good diet and exercise before and during pregnancy is also another health component to having a healthy baby, as much as all of these other things combined. It's more subtle, but it really does have potential benefits, not only the short term, but we think in the long term relative to the problem of childhood obesity.
While Dr. Catalano continues his research, Talitha and Brianna continue their own quest. They're not waiting on study results to manage Brianna's weight problem.
So this is something you really want to do. Mm-hmm. How come you're determined to lose some weight?
Because I don't want to get diabetes.
We don't want the diabetes. We don't want the heart problems. We don't want none of those issues. So that's why we're jumping on the issue right now.
One thing that's important to mention, just because you may be a thin or healthy weight woman, you're not off the hook. If you get pregnant and pile on excess pounds, you're less likely to lose your baby weight and thus be overweight for any subsequent pregnancies. Now, this may explain why some children born later in the birth order of families may be heavier than the firstborn children. Their moms were more likely to be heavier at the time of conception due to the fact they never lost all the weight from previous pregnancies. The fact that Dr. Catalano emphasizes the importance of what happens before, during, and after pregnancy brings us to the topic for our next guest. Dr. Robert Needleman is a pediatrician at Metro Health who has taken over the writing of books for the original Dr. Spock, and he knows how important it is for new parents to create a healthy environment after pregnancy in the home for newborns and for babies. The fact that 12% of children in Ohio that are preschool aged are obese points to just how important this is. Dr. Needleman, thanks for being with us today. Appreciate that.
My pleasure.
Why is intervention beginning at birth considered to be so essential?
The patterns that children follow for their whole life are really laid down in the first 3 or 4 years of life. So if you get things off to a good start, kids are more likely to follow along in that healthy pattern. That's why the first years are so important.
So what is it that parents can do at an early stage of the baby's life to really get things going on that right track?
Sure. So one of the first decisions that any parent has to make is breastfeed or not. And parents need to take very seriously the fact that breastfeeding does have a role in preventing obesity, as well as many other positive things, as well as helping parents to lose their pregnancy weight and get back to their normal pre-pregnancy weight. So the decision to breastfeed is maybe the first decision, and that's one that parents ought to consider very carefully.
And I'm sure some parents are sitting there thinking, we don't have that option for whatever medical reasons. The other ways are still valid, though, using...
Of course, many of us grew up drinking from the formula,
babies, yeah.
and we have done okay. But overall, parents now have the information to know that breastfeeding is a good choice if they can make that choice.
Do you see a lot of commonalities when you look at parents of children who are obese? You say, oh, they did this item, they did this item. Are there things we can look for?
Yeah, there's some patterns that we know. For example, television viewing, particularly young children or in excess, certainly is associated with increased obesity. And that makes sense when you realize how much money is spent each year in selling unhealthy food to children. Mm-hmm. Nobody ever gets this right. It's about $12 billion a year spent in marketing foods to children. And of course, that's not marketing apples, oranges, carrots, and other really truly healthy things. Nobody's marketing celery. That's marketing processed foods, which are high in fat, high in sugar.
And we see the kids become picky eaters, perhaps because they've been taught to go that way. We know that children's eating patterns are determined, as you said early, by age 4. So parents really have to start and think right away, let's make this an option for us as well as for the kids.
It's really a family decision. So children will adopt the eating patterns that are in their family. Kids in Cleveland eat very differently from kids in Beijing, for example. And that's not because the children are different, it's because the environment of food that they grow up with is different. So whatever it is that is considered good food in your family, that's what you're likely to grow up wanting to eat. That means that parents need to make healthy decisions in their whole family, and then when a new child comes into that family, they just grow up with that food
almost
environment.
Encouraging each other before you can encourage the kids.
That's right. And it doesn't, the flip side is it doesn't make very much sense to say, look kids, you eat healthy, we'll continue to eat our unhealthy food. So it really has to be a family decision. Then children will naturally grow into a healthy eating pattern.
We talked with doctors earlier who suggested things that are practical, like avoiding birthday cake, because we know how much toxin is in that in terms of going toward obesity. But if you're 4-year-olds at a party and all the other 4-year-olds are eating birthday cake, how do you keep yours from doing the same thing?
Well, how many birthdays does any kid get to go to at any given year? Not that many, right? Mm-hmm. Unless you're in a really big class and everybody's your friend. Basically, celebratory foods at the times of celebration is not where kids get into trouble. Where they get into trouble is sweets and high-fat, high-salt foods every day or every week. So the issue is save the birthday cake for birthdays, right? And if you really feel a need for cookies, bake them yourself. And then you have the opportunity to learn about measuring things and mixing things and gaining some skills. And you don't do that every day of the week. So it's more important to create an everyday food environment which is healthy and allow the foods that are there for celebrations to be there for celebrations.
Okay. So bottom line is be the example and think before you act.
Yeah, that's right. It's called leadership. And when parents exert that kind of positive leadership, they can feel good that they're helping their children take the right path.
Dr. Robert Needleman, thank you so much.
My pleasure.
In this program, we've established that childhood obesity is a big, complex, and serious problem that requires innovative solutions at many different levels: cellular, metabolic, social, interpersonal, and societal. We looked at the Ohio Fat Map to appreciate just how staggering the problem of childhood obesity is in our state and our region. We met Victoria and learned how something as seemingly benign as boredom can contribute to obesity. Kimberly and her family showed us how obesity can cause very serious problems to a child's internal organs, such as the liver. What kids eat at school was a big factor in childhood obesity. We learned about a trailblazing program in the South Euclid-Lyndhurst School District that is making school meals a whole lot healthier. Jake's story showed us how his fight against obesity involves simple but effective experiments he's testing out at home and in his neighborhood. And we learned that childhood obesity can start in the womb or even before conception. We want to thank all the children and families for being brave enough to share their stories with us, plus thank the medical experts who shared their insights and their sound advice. One final reminder to visit our website at health.ideastream.org for a list of resources, more stories, and no or low-cost ways you and your family can lead healthier lives. You will also find a link to our partner, Net Wellness, a consumer information website from Case Western Reserve University, The Ohio State University, and the University of Cincinnati. For all my colleagues here at IdeaStream, I'm Rick Jackson. Thanks for watching, and be well.
This was a presentation of Be Well, a multiple media health information project presented by WVIZ PBS IdeaStream. Funding comes from the Dr. Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, the Woodruff Foundation, and the Community Foundation of Lorain County. Additional support comes from the Mount Sinai Healthcare Foundation, the St. Luke's Foundation, the United Black Fund of Greater Cleveland Incorporated, the Faro Foundation, and RPM International Incorporated.